Hi everyone, I'm Barry Mitchell and welcome to Simply Science. We're at the Red Door Community on West Houston. They offer group counseling and other free services to cancer patients and their families. We'll take a look inside a little later. October is Breast Cancer Awareness Month, and according to the American Institute for Cancer Research, breast cancer is the most diagnosed cancer among women in the world. Ari Goldberg spoke with the chief breast cancer surgeon at Mount Sinai West to get the basics on the science behind this terrible disease.
Women make up 50% of the country, and they're fearful. Everyone knows someone with breast cancer. 1 in 8 women get it. So everyone has a family member or a friend that has had breast cancer.
Breast cancer is one of the most prevalent types of cancer in the world. But for all the exposure, from pink ribbons to pink baseball bats, just how widespread is it? Dr. Stephanie Bernick is the chief of breast surgery at Mount Sinai West.
The issue with breast cancer is it affects so many women. Many women survive, that's the good news we have, but the numbers are really large. It's about 240,000 women a year will be diagnosed with breast cancer.
To put that number in perspective, it is the most commonly diagnosed cancer in American women. And as of just this year, breast cancer has surpassed lung cancer as the most common cancer worldwide, across all genders, with an estimated 2.3 million new cases in 2020. But on a scientific level, just what is breast cancer? What is exactly going on in a cell when cancer is happening?
So most cancers start with a break in the DNA. So the DNA is what makes a cell, and a person, because all these cells come together. When you have a change in the DNA, the cells start to grow abnormally. So that's really the easiest way to think about cancer. In your body, you actually have mechanisms to fix problems that occur in the DNA, because that's a natural process that can happen. The problem occurs when the body can't repair a damaged cell. So something sort of goes wrong and the body can't compensate.
Now, every cancer is different. A mass of damaged, abnormal cells that just keeps growing and growing in your pancreas is different than one in your lung, is different than one in your breast. And on top of that, there are different types of cancer even within a class of cancer. For instance, the blood vessel cells of a breast could become cancerous, or the milk glands could, or milk ducts. About 80% of all breast cancers are growths of the milk ducts, invasive ductal cancer.
When cancer grows, it's sort of compressing normal tissue. So if cancer spreads to your liver, it's compressing that normal tissue. It's using the nutrients from the body, and the liver in the body can't function normally anymore. So that can happen elsewhere as well. It can happen in the brain. Breast cancer tends to spread to bone, brain, liver, and lung. So when these cancer cells start taking over the space that's supposed to be occupied by another organ doing its job, that organ can't function anymore.
Just how many types of cancer there are is one of the things that make treating it so tricky. Because there are even further divisions. Do your invasive ductal cancer cells have hormone receptors that make their growth fueled by estrogen? Do they have growth-promoting proteins inside them? The list goes on. Point being, no two breast cancers are alike. No two cancers are alike. They are in many ways different diseases, needing different treatments. The good news, or at least the silver lining, is how far we've come in fighting it. If someone gets diagnosed with breast cancer, what is the future looking like? What is the prognosis?
So the prognosis for breast cancer is getting better and better. We have more and more treatments. People are living longer even when they have metastatic disease, which would be disease outside the breast area.
Indeed, while breast cancer may make up 11.7% of all incidences of cancers worldwide, it makes up only 6.9% of the cancer deaths. To put that in perspective, lung cancer makes up 11.4% of incidences, but 18% of deaths.
In today's world, if we can find someone at a stage 1, survival is going to be between 90 and 95%. And sometimes it's even higher. So that's a very good outlook for a patient. It is very curable now. We've been making such great strides. Hopefully we're going to get to a point where we eradicate it soon.
For Simply Science, I'm Ari Goldberg.
Breast imaging to detect cancers at the earliest possible stage has made enormous progress. Donna Hanover has more.
Mammograms, X-rays of the breast, were a giant step forward in finding breast cancer and saving women's lives. Dr. Elizabeth Morris, the chair of radiology at UC Davis School of Medicine, says studies in the 1970s proved their worth.
So mammography was a huge advance for picking up cancers before they actually became big enough, before the woman or doctor would feel a mass in the breast. Women who are screened have a 30 to 40% decreased chance of dying of breast cancer.
But one problem is that dense breast tissue looks white on a mammogram, and so does cancer, so it's hard to find. Improvements have been made. First, digital mammograms gave lots more images. Then came tomosynthesis, where mammograms take images in narrow slices so dense tissue doesn't obscure cancer as much. Also, ultrasound is sometimes used to look closer into the breast if there's a worrisome spot. But now there is a big new advance. It's called contrast screening. For contrast screening, the woman is injected with a solution that travels in the vein to the breast. How does it work?
The cancer has blood vessels, and anytime it grows, it has more blood vessels than in the surrounding breast tissue. And so the contrast highlights that and it makes it visible. So we're not actually seeing the cancer, we're seeing the blood vessels that are supplying the cancer.
If the woman's getting a contrast-enhanced mammogram, a cancer can really stand out in the X-ray.
So you will be able to identify these exceedingly small cancers with contrast that you could never see with regular mammographic imaging without the contrast.
Another form of contrast screening is MRI, and Dr. Morris is a big fan.
The data is very compelling that screening with contrast with MRI saves lives. I think if I could screen everyone with MRI, I certainly would. It's a safe test. There's no radiation involved, so there's no X-rays. The problem is it's expensive. It's not everywhere. So there's a real access issue. We really need to rethink how are we going to be able to deliver this test to the population.
So a woman that's watching this and hears this, can she go into her doctor and say, I want the MRI?
If she wants to pay out of pocket, probably, but the insurance companies will really only cover it for people who are high risk or perhaps personal history of breast cancer.
The original MRIs for breast cancer were lengthy. That's tough for people who feel claustrophobic in an MRI machine. Now they can take just a few minutes and cost less.
At UC Davis, we're trying to put together an American abbreviated MRI screening trial in the hopes that we can get some data that the insurers will cover.
Another big development in breast imaging is the use of artificial intelligence.
Say you have 1,000 mammograms that you're looking at. The AI algorithm can look through all of them and say, these 100 mammograms have possibly something suspicious on them. Pay extra special attention to these. So that's very helpful to the radiologist.
So considering all these advances, should women continue to get their regular mammograms?
Absolutely. Women need to continue to get mammograms. My whole goal at work is always to find a cancer at the earliest possible point in time. And that is when they have less of a chance to metastasize, which means move to other parts of the body. I encourage every woman 40 and above to have their mammogram every year. It saves lives.
I'm Donna Hanover for Simply Science.
This year, experts predict more than 281,000 women will be diagnosed with new cases of invasive breast cancer. And the Italian-American Cancer Foundation is working hard to make sure all women have a chance to get the care they need. Here's Mike Gilliam.
This year, experts predict more than 281,000 women will be diagnosed with new cases of invasive breast cancer. They say the key to survival is early detection, and the American Italian Cancer Foundation is working hard to make sure all women have a chance to get the care they need.
We have a mammogram bus that travels the 5 boroughs of New York City, providing no-cost mammograms to women where they live, where they worship, where they go for other health care.
Ruth Vega is the Director of Cancer Screening Outreach and Education at the Foundation. She says they go to women so they don't have to come to them.
We go to medically underserved neighborhoods where we know that women are not getting their breast cancer screenings on an annual basis because of either lack of health insurance, geographic location, that it's hard for them to get to a major hospital or a radiology facility, or just because they don't know where to go because they don't know how to navigate the healthcare system.
And they've been screening patients in their communities for a very long time.
Over 30 years.
Really?
Yeah.
Their newest bus is quite impressive.
It's broken up into 3 compartments. When you go in at the front, you have a medical intake just like in any other clinic. And then you're taking into the second room, which is where our nurse is. Our nurse will do a clinical breast exam and will answer any questions that the woman may have about her breast health and what she can expect in the mammogram. Then she goes into the third room where we have our radiology technologist, which will do the actual mammogram. Once the woman is done with her mammogram, then she exits the bus and that's it.
This was the first time doing it, and actually I'm surprised how clean and comfortable it was. And hand sanitizer, 1 patient at a time. You know, given the pandemic, I really appreciate that. The staff was wonderful, compassionate, and caring.
After the paperwork, I got an exam, a breast exam, and then I was given a mammogram.
And how would you characterize the experience? Was it a good one?
It was an absolutely great experience. I used the bus because I started a few years ago when I did it with my church. They wanted to do something to have it accessible for the community. Also, at that time, I didn't have insurance because I was between jobs, and it was something that was free to do. And because I had a good experience, even when I did get insurance, I continued to do it.
Prior to the pandemic, the foundation says they were screening about 4,000 women a year inside their bus. Now, that number has since fallen off just a bit, largely because of social distancing and also only allowing 1 woman at a time in their rooms. Ruth says they are not seeing any apprehension from patients during the pandemic. And in fact, many are anxious to sign up, especially if they missed a screening during the lockdowns. Women should get screened annually.
Once a year, hopefully the same time every year, the same month, but that is the recommendation.
Appointments are required.
They just call our hotline, which is 877-628-9090, and we will find them a location where our bus is going to be, which is close to their home. We'll sign them up, get them on our schedule, and then they can just come on over to our bus.
Celebrities and high-profile people are a big help in spreading the word. Recently, Senator Amy Klobuchar announced that she was treated for breast cancer.
It destigmatizes, being diagnosed, and it also shows that, you could get care, you could get treatment, and you could survive it. It's not a death sentence.
Mike Gilliam for Simply Science.
Staten Island has the highest rates of breast cancer in all of New York City. Our Andrew Falzone spoke with 2 researchers at the College of Staten Island who are trying to figure out why.
The College of Staten Island campus, or CSI, is home to its own Breast Cancer Research Institute. A unit within its Center for Environmental Science is co-directed by researcher and environmental lawyer Donna Gersley and professor of engineering science, environmental science, and physics, Dr. Alfred Levine. The Research Institute, or BCRI, actually began as a research project.
My thesis took a look at cancers on Staten Island. Being a native Staten Islander or a lifelong Staten Islander, I had always heard growing up that Staten Island had an extremely high cancer rate.
And that research interest quickly became more focused.
We then went from looking at all cancers to looking at breast cancer specifically because it had the highest rate throughout New York City. So that's initially how we started the Staten Island Breast Cancer Research Initiative.
Simply Science obtained cancer rates from the New York State Department of Health, which confirmed that from 2014 to 2018, Staten Island had higher rates than both New York City and New York State when it came to all types of cancers, and specifically female breast cancer.
And getting the information out of the obituaries, getting it into computer records, coding it reliably, making sure that no errors were made in the data entry required a lot of effort.
NBCRI sourced its own data set, over 10,000 death certificates obtained from the New York City Department of Mental Health and Hygiene between 1985 and 2006, which included 923 incidents of breast cancer. It was then cross-referenced with obituaries from the Staten Island Advance to provide a life history about the deceased.
This is a massive data set.
But it seems like the study doesn't really work without that data set from the Staten Island Advance. Is that correct?
Absolutely correct. This is a place where local journalism provided information that could not be provided anywhere else.
In analyzing the data set, BCRI used guidance from a prior federal government study on breast cancer.
One of the questions that needed to be asked was the question, are there different points in the woman's life at which they are more susceptible to exposures?
These critical times in a woman's life were in utero, puberty, pregnancy, and menopause. So we had information on where someone was born, as well as where they spent their puberty years.
And the results of the research were clear. The study found that women who went through puberty on Staten Island are 35% more likely to die of breast cancer than women who went through puberty elsewhere. While the study does not claim to know the cause, it does discuss Staten Island's unique environmental risk factors, including the presence of serpentine, a rock containing naturally occurring carcinogens including asbestos, chromium, and cadmium. Also, Staten Island's now defunct landfills, Fresh Kills, and the Brookfield Superfund site.
We at the center continue to study if we can find the causative factor. But one of the approaches to finding the causative factor is to put the result out there and see what other people find.
I'm Andrew Falzone for Simply Science.
Maybe you've heard of Gilda's Club here in the West Village, the legendary New York City free cancer support organization for men, women, and children. The pandemic forced them to go virtual, bringing about an expansion of services and even a name change. For 26 years, New Yorkers have been coming to this West Village townhouse for comfort and encouragement.
We are very much a welcoming community of free cancer support, education to empower cancer patients and their families. My name's Lily Safani. I'm the CEO of Red Door Community. During the pandemic, we learned very quickly that we could do so much more for our members virtually as we transitioned seamlessly to a virtual program from an in-person program. And we realized our participation increased by 55%, which was unprecedented for us. And we evolved. We evolved to an organization called Red Door Community, formerly known as Gilda's Club New York City, an organization whose mission is to serve cancer patients and their families, underserved, uninsured, men, women, teens, and children. We are bilingual. We are the only place that provides cancer support all the way through every stage of the cancer experience, even also bereavement.
Joining Red Door let me express things that my family and friends never let me do.
Katie Burns Amrine attends meetings virtually.
My story started March 2018 when I was diagnosed with triple negative breast cancer. I had just run the marathon in November before I got diagnosed, so I was in the best shape of my life. And I thought, okay, I'm gonna do everything, it's gonna go away, life's gonna go back to normal. I'm gonna do the chemo, I'm gonna do the surgery, I'm gonna have the radiation, and then it's gonna be just like it was before. That was my theory of the cancer. Unfortunately, that was not cancer's plan. The new treatment would end, I'd have a good 6 months, it would show up someplace else. Like I had a brain tumor, I had cancer in my thyroid.
Do you ever say, oh, the heck with it, I'm just not going to do treatments anymore?
I do feel like that sometimes, but I also have my 2 children and my husband, and I don't want to leave my children. I love Red Door Community. They saved me last year when I was at a point where I didn't want to do it anymore.
The nonprofit organization changed its name to Red Door Community in July 2021, but
Gilda Radner will always remain an important part of who we are and the foundation of our organization.
America fell in love with Gilda Radner as an original cast member of Saturday Night Live in 1975.
She was diagnosed with ovarian cancer and died in 1989. And she showed the world that you can talk about cancer and laugh about cancer and still live your life.
Oh, I'm sorry, Gary. I haven't been on television for a while.
Oh, yeah. What was wrong?
Oh, I had cancer. What did you have?
We will continue to provide our services virtually, but we will go back, when it's safe, to an in-person program.
It took me a year to ask this question to the group. Do you ever feel like that you're failing in your cancer journey? But I was very surprised with people's responses, and that's when I knew that I was in the right place, that I was in the right support group. People answered honestly, and people, really care.
Red Door Community is a place where no one has to face cancer alone. Not today, not tomorrow, not ever.
Every breast cancer diagnosis, treatment, and recovery is unique. Lisa Beth Kovitz spoke with a breast cancer survivor about her personal battle with the disease, who found healing through a dazzling work of art.
Does this make sense? Breast cancer is a period, not a sentence. It's something like that. So it's not a death sentence. It's not always a terminal diagnosis. One can get on with one's life.
After a wonderful experience at the Toronto Film Festival, filmmaker Judy Gladstone noticed a dark mark on her left breast. She showed it to her daughter, Ella, home from college because of COVID.
She was certain it was a bruise, but I showed her that when I, hit myself on it, it wasn't tender at all. So we had my family doctor book a mammogram ASAP.
The mammogram showed multiple types of cancer growing in both breasts.
Breast cancer does not transfer from one breast to another, so this was as if 2 different cancers appeared at the same time. There is no breast cancer history in my family. Also kind of a little bit erroneously assumed that as a small-breasted woman, if there was a lump, it would, reveal itself. It wouldn't be such a big secret that only a mammogram would discover it.
This was not Gladstone's first battle with cancer.
Thyroid cancer have a 15% greater chance of developing breast cancer. So I'm sharing that information with all women who have been treated for thyroid cancer to make sure to get mammograms. Although there are similarities, the end result of losing part of the body that is so external and is tied into a woman's sexuality and how we, present ourselves, what clothing we choose, cleavage, all these kinds of things. Obviously, the difference is huge. Nobody was busy fondling my thyroid or caring about it.
Gladstone's surgeon gave her the option of a triple lumpectomy, which would have allowed her to keep the right breast.
But I felt better just thinking, take out the whole shooting mat, send it off to the lab, do pathology on the whole thing.
Gladstone also opted for immediate restoration.
I felt emotionally I wanted to wake up and not feel flat. Many women decide to remain flat. And I think if I had a different figure, if I was a little bit taller and leaner and not more of a the curvaceous, I might have opted for that too, because it can be very beautiful.
Gladstone had an opportunity to take her healing in an exciting new direction when she met artist Marina Dempster.
I actually really, really liked the breasts that I had, and was very confident with my breasts, fortunate with my breasts. I had had so much pleasure from my breasts, the memories of breastfeeding, everything. So I wanted something to document them before they were going to be taken away, before they were going to be amputated. But she came on a Sunday. The surgery was scheduled for Monday morning, and she did a bust of my bust. Post-surgery, I found the time to look her up online and discover that she is extraordinarily accomplished. And I commissioned her to do the same for the bust of my bust. Now you know what my original bosom looked like. And you can see why I was so proud of what I had. I'd love to encourage people who are going through a mastectomy to find something creative, to turn that amputation into something beautiful, something of beauty, I think is, just brings joy.
And that's our show. Remember, you can always find us at tv.cuny.edu, Facebook, YouTube, and Instagram. I'm Barry Mitchell. Thanks for watching. Stay safe, and we'll see you next time on Simply Science.